Hi, welcome to the Dr. Paul Show. I'm Dr. Paul. Today I want to talk about eating disorders. Before I get into it, though, please press like and subscribe in order to stay up to date with the most current information. Eating disorders is something I've seen for a lot of my career. When I started in the early 1990s, I had met a nutritionist and a couple psychologists that were working with eating disorders a lot. That was really a lot of their practice. And when I met them, and they already knew that I was very interested in mental health, even though I was a family doctor, and still am. I was very interested in mental health early on, and so they picked up on that, and they started referring people to me. And so I learned a lot from them because they were basically really taught me about the subject and how to and what they did on their end as far as nutritionists, as psychologists. But they sent them to me because they needed medical treatment. So basically the three main ones, there's a lot of different types of eating disorders. The three main ones I'm going to focus on are anorexia nervosa, bulimia nervosa, and binge eating disorder. So anorexia nervosa is basically people we call body dysmorphia. So people who believe they're overweight and they're actually really thin. So everyone else looks at the person and says that person looks unhealthy, that person is way too thin. But when they look in the mirror, they don't see that. They look and they look and they pick at every little part of their body and they, well, this looks a little bit too big here and this or that. And so they look at something and they're not happy with it. So they end up starving themselves, or they eat very small quantities of food, and they can get down to, I've seen one case that was so bad that she ended up dying. She got down to about 60 pounds and she got hospitalized, but then she ended up dying. Karen Carpenter is an example of a famous death from anorexia. But they're very difficult to treat because they're so obsessive and when you try to get them to eat more, they resist it. You're going to see it more commonly when women. It's definitely more common in women than men. It's also more common in certain sports, gymnastics, ballerinas. Those are big ones. Any type of sport where there's an emphasis on weight. With guys, it would be wrestling sometimes. Again, gymnastics, dancing sometimes. So how do you approach it? Well, basically their thinking is extremely irrational, obviously. They don't see what everyone else sees. So this is where medications come in. Medications like antidepressants and mood stabilizers try to help to balance their chemistry so that they are more likely to because most of them have depression or they might be bipolar even, and it's very difficult with just even talk therapy. So that even the therapists that I worked with and the nutritionists realized they needed medical treatment, which is why they sent them to me. Medications can have definitely help, but what they do is they get to the underlying mood problem, and it gets them more. They're more able then to see that the reality of the situation, that they need to change their nutrition. Some of them need to be hospitalized. Some of them need to go to like a program where they're there for a few months even so they're monitored very closely, and because some of them are so resistant to change that it's very difficult sometimes. They're very obsessive about what they eat. When they're eating, like at home, they think about every calorie. They look at the fat content. They think all fat is bad, even good fats like avocados or other types of good fats. So since they're so obsessive, it's and then sometimes they'll only cook on their own. They won't trust anyone else cooking for them. So again, they can be really tough and obsessive patients. Bulimia nervosa is, and then again, there's a lot of mixture. Some of the anorexic patients can only do that for so long because it gets so weak. But speaking of anorexia too, there's a lot of risks involved. Not only death if it gets bad, but also bone loss. So some of these women or girls, they stop their menstrual cycles. And then what happens is their bones can get brittle, so they can get like osteoporosis, like elderly women they can get it at a young age, and that's sometimes hard to reverse. And so there's a lot of risks that happen with anorexia, and so and there's cardiac risks. There's a lot of medical problems. Bulimia nervosa is when, and sometimes there's a switch. They eventually they can't starve themselves anymore. They get too hungry. They start eating, and then they start feeling guilty. So they'll eat and then they'll throw up. Now, with bulimia nervosa, sometimes what happens is a lot of binge eating. So they'll secretly eat till they're really stuffed. They'll feel guilty, and then they'll go throw it up. So in a sense, they get the pleasure of eating and binging on foods, and then they get rid of it so they don't get the weight gain. It's a very unhealthy habit. There's different ways of purging. There's the throwing up type of purging. There's also laxative use, using a lot of laxatives. So there's also the over-exercising. Some people who exercise like 2 or 3 hours a day of cardiovascular exercise, like way overdoing it in order to try to keep their weight down. So it is very much, I look at eating disorders as kind of an obsessive compulsive disorder, but having to do with food, whether it goes in, whether it goes out. With bulimia patients, also a lot of risks, cardiac risks. Sometimes their teeth get really, because of the stomach acid that comes up, their teeth gets eroded. They have to have a lot of dental work done because of damage to the teeth. And so again, it's also something that medication can really help. For anorexia patients, usually it takes very low doses for them. For bulimia patients, it actually usually takes higher doses. The typical medication that helps is a SSRI, like a Prozac, a Lexapro, which is not often my first line medication. If you watch my show, you know that I much more commonly will use other medications like SNRIs, like Pristiq, Effexor, things like that. But in this case, usually SSRIs are the first line treatment. If they have a bipolar component, then adding a mood stabilizer can help. If their thinking is really irrational, and if the SSRI it doesn't get them there completely, then I combine medications. Binge eating disorder is extremely common. Now, this is people who eat way too much and they don't purge it; they keep it in. So these are the people that are overweight. So it can be, which is very common in our society. But sometimes the overweight gets to the extreme. I mean, everyone's seen these like shows about people who are 400, 500, 600 pounds. They can barely move. They're very limited because they're so big. And so these are people who are obviously self-medicating with food and to the point where they're extremely unhealthy. So now we have also cardiac risk, diabetes, strokes, a lot of risks with that. So also treatable, with medications, because these patients are also depressed. So antidepressants can help. I use a lot of times with my bulimic patients and my binge eating patients, I use Topamax. Topamax is a medication that can really help curb the cravings for sugars and carbohydrates, which are the typical binge foods. So Topamax can be very, very helpful. Sometimes a stimulant. There's one called Vyvanse, which has been approved for binge eating disorder, which is actually an ADD medication, but it also with them it can help to decrease their daytime appetite. And then what I do with Topamax is I give that into the evening, in the early evening, because most of the binge eating, or a lot of the binge eating, happens at nighttime when people are stressed. And so even people who are not that much overweight, but people who struggle with their weight, and binge at night, and we call this stress eating, or that's why we call them comfort foods, because people will stress eat on sugars and carbs. A lot of people are probably watching this are thinking, nodding their head, yeah, like, yeah, I do that. Topamax is an invaluable medication that I use. A lot of doctors don't know how to prescribe it. They think there's too many side effects. Well, there can be if you don't know how to dose it properly. Thankfully, I prescribe it for over 30 years now, so I'm very, very adept at knowing how to prescribe it and how to dose it. It's not for everybody, but for a lot of people, it's extremely helpful. So eating disorders is an extremely common problem we have in our society. The good news is there's treatments. People have to be willing to be treated, of course. And there's other types of eating disorders too, but those are the three main ones I want to talk about today. I hope you enjoyed what you heard today. If you like what you heard, please share with your family and friends. If you know anyone who's struggling with an eating disorder, please share this with them. And if you have any questions or comments, please send them my way. I answer every one of them. And thank you for watching.